And today I'm with my partner, Valentina Astua Chanto. Today we will talk about the anxiety disorder. It is just or more than a famous mental illness. It is a comprehensive overview about causes, symptoms, and management of this illness. We hope this to be helpful for you. So let's go ahead and start discovering this incomprehensive disorder.
An anxiety disorder is a mental health condition characterized by persistent excessive and sometimes uncontrollable fear or worry that goes beyond what a person would normally experience in everyday situations. Unlike regular stress or temporary nervousness, anxiety disorders last for a longer period of time and tend to interfere with a person's ability to carry out daily activities, such as studying, working, or maintaining relationships.
Now, there are multiple types of anxiety disorders. We just pick up three of the most experienced nowadays. First of all, we have social disorder. It is described as a kind of fear or fear of being criticized in a social field. It is normally found in people who had a traumatic experience in the past. Then we have the panic disorder. It is a sudden episode of intense fear for the future. It is remarkable to note that not always there is a cognitive reason to sort, like a thought or a stimulus. It just happened. But actually, there should be an increase or decrease of the adrenaline to be induced to have this disorder. And the generalized anxiety disorder is the most famous one. It is chronic and most possible referred when somebody talks about anxiety disorders.
When we talk about the causes and risk factors of anxiety disorders, we usually refer to a combination of biological, psychological, and environmental influences. One important factor is genetic predisposition. This means that if someone has close family members with anxiety or other mental health conditions, they may be more likely to develop it themselves. Another key factor is traumatic life events, such as experiences of abuse, accidents, or any situation that creates long lasting emotional stress. These events can shape how a person reacts to future challenge and increase their vulnerability to anxiety. Substance misuse is also a major contributor. The use of alcohol, drugs, or even certain medications can affect the brain's chemistry and make the symptoms worse over time. Additionally, chronic medical condition can create ongoing stress in the body, which may lead to or intensify anxiety.
Then there are many symptoms of anxiety. You can feel the muscle tension, mostly on the elbows, the legs, the back, the chest, and the shoulders. The tension could be described as a pressure or a burn inside of the muscle. You also have or could have breathlessness and feeling to be on the edge or to be at the finish. You can rapid hyperbreath and shortless heartbreak. It is common the patient to tell they are having like a heart attack or stroke or even that they are dying. In a cognitive way, you can perceive confusion and difficult to concentrating. Also, it can be described as if the patient to be incapable of control itself, its own body. All those symptoms tend to be short term, lasting between 5 to 30 minutes.
Anxiety can appear in people of all ages, but the way it looks can vary a lot depending on the stage of life. In children, for example, anxiety often shows up through behaviors rather than words. For example, many children may experience a school refusal, meaning they feel too scared or overwhelmed to attend school. In teens, anxiety can look different. Adolescents may begin to withdraw socially, avoiding friends, activities, or situations that make them feel uncomfortable. In adults, anxiety tends to focus more on responsibilities and daily functioning. Many adults experience chronic worry, especially about work, finances, or family. Their anxiety may affect their job performance, making it harder to stay productive or confident. Adults also commonly report sleep problems, such as trouble falling asleep or staying asleep, which can create a cycle that worsens anxiety over time.
Well, then we have the alternatives and treatment options. We as psychologists will always recommend to go to therapy. Any other option, such as self-serve, self-help strategies, or meditation, etc., could be helpful, but professionally supported is a must. Um, as previously stated, meditation, mindfulness, relaxing, living on the present, exercise and nutrition check, they are all valuable perks to reduce the adrenaline, and also they increase the gamma aminobutyric acid, which is the controller of the nervous system, the neurons and nerves in the whole body. Also, you can mind support groups and peer therapy. They are useful too, as mental illness. It's recommended people that shows to get better by spending more time with others with the same medical condition.
Self help strategies can play a very important role in managing anxiety. One helpful strategy is journaling thoughts and emotions. Writing things down allows people to identify patterns, release worries, and understand what triggers their anxiety. It's a simple but powerful way to gain clarity and feel more in control. Another effective method is practicing daily deep breathing exercises. Slow, controlled breathing helps calm the nervous system, reduce physical tension, and bring the mind back to the present moment. Even a few minutes a day can make noticeable difference in how a person reacts to stress. Maintaining a structured routine is also beneficial. Having habits such as regular sleep, meals, and study or work schedules create a sense of stability. And finally, limiting caffeine and alcohol is important because both can increase anxiety symptoms. Overall, these self-help strategies do not replace professional treatment, but they can greatly support a person's emotional well-being.
Finally, we're up to talk about a few myths and facts about this serious mental illness. Um, First myth, it is just stress. The fact is, anxiety is a diagnosable, real, and static disorder. Myth, you just have to relax. The fact is, the anxiety is not just controllable with will. There should be diagnosed, supported, and even followed by pill treatments. The last myth is that anxiety is negative and harmful. Nowadays, actually, is being discussed if anxiety is more a moodlet or a human trait. Anyway, in a moderate level, it can be extremely helpful to foretell and prepare us for the future.
And finally, it's important to remember that anxiety is a challenging experience, but it's also something that can be managed with the right support. Take the first step, reach out, speak up, and never underestimate the power of support.